Hey guys, Dr. Justin Marchegiani here. Today we're going to be talking about electrolytes. I get these questions all the time. Why do I have chronic electrolyte issues? So the big electrolytes that we're going to see are going to be potassium, magnesium. These are hard to get in your diet in general. I mean, you can go to Chronometer, justinhealth.com/chronometer, and just run your food through the day, and it will tally up your micronutrients, and it'll give you a window into how you're doing with potassium, magnesium. You're going to find that most people just do not get enough potassium or magnesium. It's really common. Now, we do need sodium and chloride, and we do get a lot of that in more processed food, but not good quality sodium and chloride. Not like Redmond's Real Salt or a Celtic salt or a Himalayan or a Baja Gold. These are going to be really good electrolytes and really good minerals. So we love a combination of both. Some people will do a 2-to-1 ratio or a 1-to-1 ratio on the potassium side of magnesium. And I'll go into kind of what I do with my patients. But first off, one, you're not getting enough electrolytes in your diet. That's like the easy one. You're just not enough. Two, you're sweating a lot. You're outside. You need more electrolytes, and you're probably still deficient in your diet. So good, clean water. Maybe your water's RO. Our reverse osmosis or distilled, and you're missing the electrolytes that way, and you're not adding it back in. Three is stress. The more chronically stressed and inflamed you are, you will dump out potassium and magnesium to manage that inflammation and stress. And if we're having lots of processed foods, your body will use magnesium to run the Krebs cycle and the electron transport chain. It requires, especially the citric acid cycle or Krebs cycle, same name, same thing. It requires magnesium to deal with blood sugar. So if you have a lot of glucose coming in, carbs, high fructose stuff, it's going to require more magnesium. So that's a big deal too. Also, chronic stress, chronic inflammation, the more weaker your adrenals are, you're going to have less aldosterone to help hold on to your electrolytes. So we have hormone like aldosterone, which is a mineral corticosteroid, helps you hold on to your electrolytes. It's really important for electrolytes. So we have, first off, just getting it in your diet. Two, making sure we're hydrated, not overly sweating. Three, making sure stress and inflammation is good. And four, making sure we have good adrenal function. Let's look at the adrenal. So how I remember this in school is we had a little acronym that went something like sugar, salt, sex. The deeper in you go, the better it gets. That's how you remember the adrenal gland layers. So the outer layer right here, this is the mineral corticoid layer, aldosterone. This works on your minerals, sodium, chloride, salt. And again, there's a sodium chloride or sodium potassium relationship. So if sodium goes too low, it can throw out potassium, or if sodium goes too high, it can lower potassium. So these are intimately connected. So you can see here, aldosterone, that's the salt. Then the sugar, that's the corticosteroids. So when I say salt, sugar is the next one. Our cortisol, that's a glucocorticosteroid, deals with stress and inflammation as well. And then sex, that's the DHEA, that's the dihydroepiandrosterone, that's the precursor sex hormone. And then the modifier is sugar, salt, sugar, sex, stress. The stress hormone is our medulla. That's our epinephrine, norepinephrine, our catecholamines, our adrenaline. It's crazy. Medicine makes up. It's the same thing, three different ways to say it. Norepinephrine, epinephrine, adrenaline, or catecholamines. It's the same thing. Okay? And so that's the deepest layer. So recap, we have our outer layer, our zona glomerulosa. That's our mineral corticoids. Our second layer is our zona fasciculata. That's our cortisol corticosteroids. Then we have our zona reticularis. That's our androgens and our precursor sex hormones, and then our adrenal medulla. The medulla is right in the middle here, so you can see it over here too. And that's going to be our stress hormones. So that makes sense. Again, when we have chronic electrolyte issues, we want to get it in. So with my patients, we'll do my potassium synergy, which is a 10-to-1 ratio of potassium to magnesium, so about 1,300 milligrams of potassium with about 130 or so with magnesium, and then we'll do about a half a teaspoon of Redmond's Real Salt with that, stir it up, and we'll hit that once to twice a day. And then you can do mineral waters during the day, whether it's like a Gerald Steiner or like a Topo Chico. I do like those. They do have good minerals, good bicarbonate in there too, so good stuff there. But again, get to the root cause of why you have low electrolytes. And again, you may not get enough with food. People say, I'm going to get it with food. It's really hard to get enough with food. So you may need a supplement, and you may need to deal with your stress and your adrenals. You may need to work on adrenal support too. So I'll put my recommended products down below. And if you want to dive in deeper, if you need more support on this, on the functional medicine side, there'll be links down below where you guys can reach out if you need more support. All right, guys, links down below. Take care. Have a good one. Bye now.